Hi, loves. Welcome to the Be With You show. This is your friend and your host, Sam. And on the show, we talk about love, life, and everything in between. And today on the show, we have Susanne. She is a stress illness recovery practitioner. She's a coach and a clinical nutritionist. She's determined to help people suffering from chronic symptoms recover with the mind body approach. So, Suzanne, tell us what is mind body approach?
Hello, I'm very happy to be on this show. Thanks for having me. The mind body approach is really it's like a 180 degree different approach to chronic pain. And that means it's a big topic. And when I say chronic pain, it's chronic pain and symptoms, like back pain, knee pain, headaches, migraines, frozen shoulder, gastrointestinal issues, fibromyalgia. I mean, the list is very long. It's endless actually. So what we discovered is that a lot of these issues are actually not because of a structural issue or a physical issue. It's actually because of an emotional issue. And that means the pain or the symptom is created by the brain as such, by the nervous system. And to put this really simply, actually, we go through life and we have a lot of stress, we have a lot of trauma, we have a lot of negative experience in our life. And we're all given, I call it like a container, which is our nervous system, a different size container. And we put all the stress in there so that, as you go through your childhood, you may have issues with your parents, you may have attachment, authenticity, issues with your parents or your siblings. You go to school, you have issues with your fellow students, and all that stuff is put in that container. Then you go through your teenage years, you go through your adult life. You have financial issues, you have maybe husband issues, wife issues, you have moves, you have a number of life events that cause stress. And when that container is filled to the brim, meaning your nervous system is tense to the max, your brain may decide to give you pain. And the brain decides that in order to protect you, because the brain has the rein on pain. It always does, always will, and it's always looking out for you. So the brain will possibly inflict pain or a symptom in a body part, in a weak body part. And then what happens? You're 100% occupied with treating this pain, treating this issue. You run to the doctor, you run to the alternative medicine practitioner, to the Ayurvedic practitioner, whatever. You're busy. But before you do that, usually you get downtime, you rest, and then you're occupying yourself with the pain. We all do that, and sometimes we spend years or decades doing that. Like in my case, for example, I had 3 decades of symptoms. Not that it was, super bad always, but I was always busy with something. I went through gastrointestinal disorders. I went through herniated discs. I went through migraines. I went through knee pain. I went through insomnia. I went through PTSD. I had a number of issues, and actually I'm quite happy I had these issues because they forced me to really research pretty much anything from homeopathy to Ayurveda to, of course, Western medicine first, but when that doesn't help, you go elsewhere, right? To healers, to osteopaths, to psychics and whatnot. And while I may have gotten temporary relief for some symptoms, I never got permanent relief until I discovered the mind-body approach to these symptoms, which you really learn how to empty the container of these negative experiences, trauma, and stress, and as such, give your nervous system a break so it can breathe again and it can relax, and the symptoms eventually go away. At the same time, that's one part of the approach we're taking. At the same time, you have to teach your brain that it doesn't have to inflict pain, that you can actually feel the pain in the cup. So that's kind of like a retraining of your brain, a retraining, let's say we call it unlearning the pain. And there is an approach that we call somatic tracking, but I don't want to get into the solutions yet. So maybe we cover that later. So back to you.
So when we talk about pain, what you are addressing to is generally, or maybe specifically, the chronic kind of pain. So can you just walk us through how pain is, can differentiate it into the acute pain and the chronic pain, and the chronic pain could have certain underlying causes to it, which we should investigate into.
Okay. If I understood you correctly, you wanted to know the difference between acute pain and chronic pain. Okay. So first of all, pain is essential for survival. I mean, without pain, we would possibly harm ourselves terribly. So pain is necessary, and is necessary for survival. Acute pain can happen after an injury, often does, and sometimes that's a tissue. It's an injury to the tissue, and we say tissue healing happens between 8 to 12 weeks, depending on you a bit, but maybe it takes a little bit longer. But anything after like 3 to 4 to 6 months is then chronic, which means it's a learned pain, and that's what we call chronic. Actually, anything over that amount. And pain, while it often happens after an injury, it doesn't actually have to. It can also, we all know that you can wake up with a backache, you can wake up with knee pain, and this is when the brain decided to give you pain because of an emotional event that happened. And actually the brain is creating pain. It's not the body part that's creating pain. The brain actually sends a danger signal. There isn't actually such a thing as a pain signal. There is always a danger signal sent by the brain. And as I said, chronic pain is they say up to 80% of chronic pain is actually not due to structural injury, but is of emotional origin. And it's always the brain who decides when and where to inflict pain. I mean, if you look at, for example, phantom pain, right, where you don't have a limb, you don't have an arm, for example, people still feel pain where the arm used to be. And that proves again that the brain is always causing pain. There's always also two examples that I use. There is a UK construction worker that fell from a scaffold and right onto a nail, and the nail penetrated his shoe, and he was screaming and in pain, and they drove him to the hospital. And in the hospital, they sawed the shoe off, and they saw that the nail went right between his toes. It didn't actually penetrate any skin or any flesh. It went right through his toes. But the brain decided to inflict pain, right? Because he was threatened. He was in danger. So the brain sent the danger signal. And then there is another example that I use. It's also from a construction worker that was working alone in a construction site far off, middle of nowhere, and he shot with a nail gun. He shot a nail into his hand, and he didn't have any pain because his brain knew, okay, this guy has to drive himself to the hospital, and then I can give him pain. So it's always the brain that decides, and it's also the brain that decides to make pain chronic, right? And that has to do with a lot of emotions that you have about your pain. So let's say you have a herniated disc, right? And let's say or any type of physical injury. Let's say, anything, right? And you put a lot of fear into that sensation, into that pain, a lot of frustration, a lot of resentment, and you focus a lot on that pain. We call it the neural pathway in the brain. It's like the pain highway. What happens? That focus on the pain makes the pain highway in your brain wider. Energy goes where that pain highway is getting bigger and bigger. So that causes also the pain to become a learned pain and to become chronic after it should have healed, actually. So that's why you have people after a herniated disc, for example, that spend months or years with the same pain. And the tissue has long ago healed, but the pain is still there. And that's chronic pain, and that can be treated with a mind-body approach.
Pain for the longest period of time, and there are sometimes no physical evidences of any kind of trauma or injury, and still you have those the manifestation of pain or being hurt. So how does your brain actually create this pain in a patient's body? How does it do that?
So the brain, like I said, you have neural circuits, and I'm not a doctor, just so you know that. I'm a stress illness recovery practitioner and a coach. That's specialized in a mind-body approach to healing chronic pain. So, I mean, I'm not just to have that cleared. I'm not a medical doctor,
Sure.
but what happens in your brain is that, like I said, fear and focus, frustration, emotions about pain make the pain neural circuit wider. And actually also your nervous system, like I said, when that container is full of negative emotions, trauma, stress, whatever, it's tense to the max. And medically speaking, what happens is your nervous system is all over your body, right? It's everywhere. You have, I don't know, millions, I mean, I don't know, thousands of kilometers of nerves if you roll them out. So your nervous system is literally anywhere. And what your brain can actually do is activate the nerve endings, the fibers in your body, and cause some of the worst pain you can imagine. And the person that actually discovered this mind-body syndrome first is a guy called Dr. John Sarno, and he worked at NYU Medical in New York. And maybe just to give a little history on this, he was actually a back surgeon, and he got increasingly frustrated because a lot of his patients returned after surgery or after physical therapy with the same symptom or a different symptom. Sometimes, they came back with pain exactly in the same region in the back where he operated, and sometimes they had, instead of the back pain, they had knee pain. And he was wondering, like, what is going on? And so he started talking to these patients, and he started asking them questions about, what else is going on in your life. And he found out that a lot of these people with, chronic pain or returning patients, they went through a tough time in their lives, or had a horrible childhood, had something called ACEs, adverse childhood experience, or had just, any time of a lot of trauma in their lives, and sometimes not a big T trauma, but a lot of little T traumas. And sometimes, like I said, nervous systems are different. Some people can handle more stress, and some people can handle less stress. We're all different when it comes to that, and also biochemically we're different. So then he started devising a treatment regimen, and he also discovered that this is back in the 70s when he found out about this, and we've taken the science on the mind-body syndrome a lot further since then. But what he originally said is that the nerve fibers that cause the pain also create a local oxygen deprivation and a blood flow issue. since he discovered that, like I said, things have evolved, there is a doctor in the US who's done a lot of research on what medically happens when the brain is causing pain, what happens in the body. And it's going back to that neurocircuit in the brain that's getting wider, and it's getting to the nerve endings and the fibers that are getting disrupted, let's say, via the amygdala and part of the brain that's responsible for emotions. And like I said, I'm not a medical doctor. A medical doctor can explain this much better than me, but this is what happens physically. So it's actually a known thing also in the medical model. We call it the neuroscience of pain. And there is actually also a lot of psychologists in Europe are starting to look at this and are starting to treat chronic pain with a psychological approach. So it's nothing new. And there's a lot of books out there who talk about, the neuroscience of pain and this approach, the mind-body syndrome, the TMS approach, as we call it, abbreviated, we have, like I said, devised a solution for it on how you can empty the container and how you can retrain your brain to not feel pain. And it's something that people can easily learn, either with a therapist or by themselves, by studying the books, by listening to podcasts, by deeply immersing into the science, and then heal.
There are certain neurocircuits which form in our body, and certain emotions, when they are triggered, the neurocircuit works and it causes manifest pain. And the more, like the frequency, if the frequency is more of these neurocircuits working, the more they are reinforced, and there is more instances of pain that the patient experiences, right?
Right, the neurocircuit gets strengthened.
Yeah.
So with energy, the more energy you put, it's like that with everything, right? It's also with addiction. We strengthen neurocircuits all the time in our brain by emphasizing on something. If you're addicted to cigarettes, for example, your smoking neurocircuits is going to be strengthened. It's going to be reinforced. So that's how it works with pain as well. And a lot of people in chronic pain, myself including, I spent years obsessing over whatever it was, insomnia. Researching, reading books, Googling the topic, whatever. And all the while, you are strengthening the neurocircuit while you're doing it. Even if you visit the 100 million doctors, with the symptom, every time you go to a doctor, you're telling your brain, focus, energy, make it bigger. So we call this the pain fear loop or the pain frustration loop, however you want to call it. And that's the cycle you have to essentially break. And how you break it is by sending different messaging to your brain, by telling your brain, for example, I'm safe. We call this somatic tracking, where you for example, you close your eyes, and you look at your pain neutrally. Because if you look at your pain without fear, it looks different. And then you try to describe your pain. Is it sharp? Is it stabbing? Is it how does my pain really feel like without the fear? And the thing is, you get there. You do this after you really truly understand that your pain, your chronic pain, is the mind-body syndrome. And there is a questionnaires or that you can do, or you have to immerse yourself in this topic a little bit. Like, what determines that you have chronic pain? How do you assess you have chronic pain? Like I said, up to 80% is the mind-body syndrome. That's just according to official stats done, which is unbelievable. And if you go to the doctor, to any physician, they always look at your pain as a structural issue, which is not. But like I said, there is a little shift I see in Europe. Like I said, a lot of psychologists treating chronic pain now with a psychological approach, but it's very slow. I mean, the masses are still being treated by doctors with, pain pills. Sometimes it goes all the way to opioids, fentanyl, whatever. In the States, you have a huge opioid crisis because of chronic pain. Because they have no other means to kill the pain, which is terrible. And we see a lot. As practitioners, the mind body syndrome practitioners, we see a lot of people who have been bedridden for 10 years, and then they find out about this, and they heal. But the thing is, they cannot believe that they heal, because how can this simple approach cure my chronic pain? It took me months to believe it, but that's why it's so important for people when they first hear about that, really try to understand it, really try to understand the neuroscience of pain and how pain is created and what is the mind-body syndrome. And really read books. There is a great book written by Dr. Howard Schubiner. It's called Unlearn Your Pain, which I would recommend to anybody, because he really, explains what the mind-body syndrome is in detail. And the thing is, I explain this to a lot of people, and I was like, oh, it totally makes sense. I get it. Okay, what's next? I'm like, no, you don't get it, because you have to get this in your heart, and you have to be convinced that you have the mind-body syndrome. And then once you know, you deeply know, then you also know that your brain is playing tricks on you, and then you can start to unlearn your pain by changing the messaging to your brain, by employing motion, because we say motion is lotion, by starting to do things again that you didn't do before, because a lot of people, they avoid stuff, right? So, you have pain, you don't, bend forward. For example, a lot of people with back pain, it's like, okay, never bend forward. Really? Trust me. It was my problem as well, because I had 2 herniated discs and I was totally afraid to bend forward. But I did, and I did it by telling myself, okay, I'm safe. I'm bending forward. Of course, you don't do it like from 1 minute to the next. You go about it in the speed that's okay for you, but you do it. And every time you do something like that, or every time you tell your brain, I'm safe, or I have joy in movement, or whatever your messaging is going to be, you slowly shrink that neural pathway in your brain. It slowly decreases. And at the same time, you do something called expressive writing to empty the full container, like that tense nervous system that I was mentioning. So you retrain your brain. That's part of the solution. And the other part is you do expressive writing. And I can explain how we do that quickly. So what one should do is, like, you take a piece of paper, you divide it into 3 columns. The first column is childhood, so like 0 to 20. The second column is adult life, 20 to now. The third column is personality traits. So everything that ever caused you stress, negative experience, trauma, you put as a bullet point on that list. So it can be a move from India to the States. It can be a financial strains. It can be this child stole my toy in the sandbox when I was 4 years old. Little things, whatever has imprinted itself in your container and is still sitting there, you put as a bullet point on that list. And a lot of people, they forget the holy cows, or they purposely don't put the holy cows there. And it's usually the elephant in the room. It's usually somebody that, like, maybe a husband that causes stress, or maybe a protected mother that you don't want to complain about. Put everything there. There is no holy cows. So, and then the third column is personality traits, because what we do know is that certain personalities are more prone to chronic stress. Like, for example, the people pleasers, the do-gooders, the perfectionists, the hyperactive, the unworthy, the not good enoughers, the super empathetic, the overprotective, the pre-grievers, the high achievers, the validation seekers, the legalists. The list is very long. So these personality traits, and Dr. Sarno always said it's the perfectionist that actually the worst, because when you're a perfectionist, you put tremendous stress on yourself and you usually swallow it up and you bury it somewhere. And that fills that container with emotions of frustration, anger is a big one, and whatnot, right? And there in the third column, you have to be really honest with yourself. Like, who are you? And how does this personality trait cause stress for me, right? And you list it. Because it might be different. Every perfectionist, again, is different. It might come out in a different way. And we also all have different jobs. So, it hits you differently. So you make that list, and that might take you a couple of days. And once you have that list, you take it and whatever bullet point pops out at you, speaks to you, you take that and you start expressive writing. And expressive writing is not journaling. It's not like writing your diary. It's actually, excuse my French, letting the shit out of you. So it's really venting on paper. And, what comes out first is, let's take, I don't know, you're pissed off at your husband because he comes home from work and starts watching TV and you do the household, right? So, for example, that's a stress factor. So when you write about this with this expressive writing approach, you really let it rip, and your husband is not protected. Whatever you want, whatever you deeply feel, the truth needs to go on paper. And don't worry, I mean, it's not the eternal truth, it's the truth of the moment. And the truth, or the emotions, they just want to be felt. They want to come out. Because what we do in our system, in our society, we don't feel the emotions. We automatically block the emotions. So when for example, you start feeling anger, the anger, let's say the emotion of anger starts getting into the tunnel. And halfway through the tunnel, you block it. And you do this with every emotion. And that's, again, the container is the tunnel, right? And sooner or later, that tunnel explodes. And that's when you get chronic pain. This is kind of how it works. And so when you start expressive writing, you start to reduce all the emotions in the tunnel or in the container slowly, because they want to be felt. And so that's a process, right? And what you do, like what we recommend you write for 20 minutes every day initially. You write for 20 minutes and then you do a meditation or pranayam or yoga nidra or, slow breathing to put your nervous system into rest and repair for 10 minutes, right? That's what we recommend. These are just some of the basics. There is more, but I'll stick to those three. And yeah, you really throw that paper away. So after, you don't have anybody read what you wrote. It's your personal venting on paper. Also, when you write, lock the door, make sure you're alone in the room, and don't let anybody see you, because you're going to cry, and you're going to cry more than you've ever cried before. So when I first started doing that, I mean, like I said, I had a really terrible herniated disc. It was super painful. It took me 10 minutes in the morning to get out of bed until the blood started flowing in my spine. I mean, it was horrible. And because I put so much fear and frustration and everything into it, it got chronic. So, but I discovered this pretty early on when I came down with this. And I started expressive writing, and I think it was about 4 months after the initial onset of pain that I woke up one morning and the pain was 80% gone. And I was like, wow, this is amazing. It's probably just temporary. It cannot have worked. It's impossible. So it took me about 3 weeks to believe that this actually worked, but it did. And it never came back. And then, of course, I continued, and I cried, so much that first year when I did that. But it's a beautiful thing because you get a completely different relationship with crying, because I definitely didn't cry enough before. And crying is a really healthy thing. It's also from a medical perspective, tears contain stress hormones. So the stress hormones also physically seep out of you. And we don't cry enough. I mean, most of us, we don't cry enough. And also, when you're venting on paper, a lot of times you're angry, but even when you're angry, you're crying, right? So it often comes out with crying. And the thing is, so I did that for a year, and I got rid of my migraines. I got rid of, my back pain, and I got rid of my insomnia, which is major, unbelievable. I had years of insomnia. I never slept well, but yeah, it worked. So I continue. I still do it today. I mean, I discovered this in 2020. Now it's 2024. I don't do it every day anymore. I do it like maybe once a week, but I think I will do this for the rest of my life because I'm pain free. When I say pain free, I'm chronic pain free because pain is the human condition. I mean, I also wake up with pain every once in a while, like we all do, right? But now I ask myself, okay, what happened psychologically before, in the days or weeks before? And I start writing. And what usually would have taken me, probably 12 weeks to get rid of pain wise, I can now resolve in a matter of a couple of days, which is unbelievable. And I still, to this day, I think it's a godsend. It's a miracle. And I feel like I was truly blessed to discover this. And so because it worked so well and because it works so well for my patients as well, I really would like to share this with the world because it's not known so much in Europe. It's not well known, but it's more known in the US, the UK, also Australia, so the Anglo-Saxon world. But it's literally untouched in Europe, mainland Europe and India, I think also, right? So I just think we need to know this and people need to be self-empowered and enabled to take chronic pain in their own hand and heal because it's a pandemic. I mean, just so we know what we're talking about. I mean, in the States, 1/5 of American adults, and that's 50 million people, suffer from chronic pain or symptoms. It costs $500 billion each year in the US in direct health care or disability costs and lost productivity. It's a huge problem. And in the UK, it's like around a quarter of the UK's workforce, they suffer in silence with chronic pain. They stay in employment despite feeling like crap. And also interesting is that chronic pain is significantly more prevalent in women than men because we have a lot of these personality traits that are, prone to chronic pain, unfortunately. So it's, the stats are pretty terrible. And I just think it's high time that we have a better approach to resolving it and helping people. Yeah.
To tell you about me, myself, like when I was not even in my 20s, I used to have a lot of GIT issues. I used to have headaches and I used to have acidity. And a lot of at least 4 times a month, I used to be in my room with severe headache and indigestion, GIT issues, and I don't know what was wrong. And I thought I was too young to even, take this up seriously. I used to think maybe I I don't know, just dehydration. It is something very normal. And in my late 20s, maybe, I started doing yoga. I started doing, pranayama, meditation. And all of these things actually helped me reach the sense of calm in my body. And that is something which helped me get rid of the GID issues and the headaches, because they used to be too severe. And for somebody who was like 15 and 16 and down with a headache, it was a very not comfortable condition that I used to be in. But now it is much under control. Not that I never have a headache, but it is still, I it is reasonable, it is handleable. And I think I can give it to the yoga practice that I do and the meditations that I do and the kind of, anxiety control that I have gained in my life, that help me get rid of those headaches. So I think our medical field, or us doctors, are so much focused on addressing the structural issue. And because that is how we are trained in our field, and we never put any light on the emotional issue of the patient. That is something which we need to learn, and that is the new approach to pain, or uh, to deal with the diseases in today's time.
Yeah.
Yeah.
I hope there's going to be a revolution, on an emotional revolution, because emotions are so undervalued. I mean, if you think about, we are not thinking beings that feel every once in a while. We are emotional beings that think every once in a while. And it's just, for example, if you have to give a presentation tomorrow in front of 250 people, you have physical reactions, right? You have a tight stomach, or maybe even diarrhea. That's a physical sensation to an emotional problem. And chronic pain is just a level up. It's more suppressed emotions and, a more pronounced physical problem. To the yoga, I mean, I agree with you. I've done yoga for 20 years. I did yoga also as part of or I was hoping for yoga and meditation to give me relief, but in my case, no. And in a lot of people's cases, it's unfortunately not enough, because what happens is you sit on the dung pile of emotions and you do yoga on top, which is fine, but you got to get rid of the dung pile. And as long as the dung pile is there, yoga and everything else you do, alternative medicine, is not as effective, because you're sitting on that pile of emotions that just makes everything more difficult. Now, I mean, for me, as I got older, my symptoms were getting more pronounced, because I mean, the dung pile was getting bigger. So I mean, I got more and more severe issues, and I was wondering, like, I'm fit, I horseback ride a lot, I hike, I run, I'm fit, I do yoga, I meditate every day, and I was wondering, why the hell do I have chronic pain? Because I'm fit, but that finally in 2020 was before COVID. My intuition just told me, Susanne, you're looking in all the wrong places. You've got to look somewhere else. And that's when I did a desperate Google search, and I don't know what I searched, other reasons for chronic pain. And that's when I found Dr. John Sarno, who wrote this book in the 70s, right, about chronic pain. And then I found many other people who've taken this topic further. But I could not believe that I never found this before, I was like, wow, why did I have to go for 3 decades to finally find this guy who wrote a book in the 70s? And I've done so many searches on this stuff, right? But yeah, so finally I found it. But
Yeah, so
better late than never.
In my case, yeah, I started with yoga, and now recently I am very much into emotional freedom technique, and all those parallel mechanisms which help you address the emotional, maybe, patterns that you carry in your life, and they're really helping me in their own way. Yeah. I would also like to ask you about how these emotions work with pain, because I am pretty, influenced with the work of Louise Hay. She is the author of You Can Heal Your Body, in which she uh, has written a lot of stories where, she herself healed her. I think she had ovarian cancer or cervical cancer, so she healed her own cancer by dealing with her emotions. So how that is where emotions can actually help you get rid of something as severe as cancer. So how do
Yeah,
you
I
see
mean,
it?
I read Louise Hay many years ago, but she was big in the Church of Religious Science. She, as far as I recall, she devised a program where she basically worked with affirmations,
Yeah.
positive affirmations. The thing with Louise Hay is, yes, she got cancer, after doing this for quite some time already, right? Then she came down with cancer because before she was kind of scratching the surface, right? With the manifestations and whatnot. And then she got cancer. Then she got really serious. So then, I mean, she did a lot of cleanses and I forgot what all she did. And of course, her affirmations. And she did a whole bunch of stuff to get rid of cancer. I don't remember everything. But her approach is obviously is a little bit different. I mean, there's many roads that lead to Rome. And affirmations as such, in addition to what we do, of course, you can do that as well. And actually, when we do the writing technique, and I just gave a quick overview of what we do in the writing technique, I always end with positive affirmations. Not everybody does, but I think it's essential that you end with the positive after purging all the negative emotions out of you. Certainly, but I think, and based on what I see and what I see in my patients, I think affirmations might not be enough. And I think also Louise Hay went way beyond. Like I said, what works for one doesn't work for another. You know, found that this works wonderfully for people with severe chronic pain, or with just a little bit of chronic pain, obviously easier, but there is this guy, Steve Osanich. He wrote a book, God, what's it called? The Great Pain Deception. And he was he also he went to see Dr. Sarno when he was still alive in New York and healed after 10 years. I think he was in bed for 10 years with horrific back pain and disc problems and a drop foot, basically couldn't walk anymore. And he couldn't even read a book. So he was just listening to Dr. John Sarno's audiobook. Every day he listened to this audiobook and he didn't do any writing. He just worked with his mind and he retrained his pathway. So he drug himself out of bed, got into his car and went to the golf course and every day shot 100 balls. And in the beginning, he almost died doing that because he could barely move. But he forced himself to do it. And slowly his brain learned, okay, it's not working anymore. I can't, this pathway is not working anymore. I have to shrink it. And what happens then often is that you get pain in different spots. So it could be that you slowly get rid of your back pain, but you get migraines. We call this the symptom imperative, which means it's working because your brain is looking for an alternative pathway to activate because it doesn't want to give up the fight so easily. So that's what happened to him as well. But he kept at it. And after 1 year, he was pain free after 10 years in bed. So, it's amazing. It's really amazing. And the thing is, like I said, a lot of roads lead to Rome. This is a system that has been proven to work, but the work has to be done by you. Nobody's doing it for you. You have to set time aside for this. But I always found it me time. I found it wonderful just because it's me time. You're doing, instead of researching what else should I do about pain, or how horrible is my pain, or which doctor can I go see now, you actually start working on the solution. And like I said, it's 20 minutes of expressive writing and 10 minutes of self-soothing. That's what you do every day. But the most important thing is understanding the neuroscience on pain, understanding what is the mind-body syndrome in detail. I would say that's 80% of the solution. And that's what I find missing in a lot of other approaches, where you don't understand the details of the approach. I mean, you can do EFT if you truly understand what is the mind-body syndrome. You can do EFT as well. Maybe it works. I mean, like I said, we're all different. To me, EFT didn't do anything, right? But like I said, we're all different. So there's things you can try, but 80% of the solution is the understanding what's actually going on with you. And Dr. Sarno, back when he first started practicing this, he saw that about between 10 and 20% of the people, they had a so-called book cure, which means they read his book and they were pain-free. It works for some people, but I think if you do the emotional work, meaning the expressive writing, I think it's much more permanent, because you actually emptied the container as well. Versus the other way, you retrained your brain, but I would really advise to empty the container as well, because then you also decluttered your nervous system. Then it's like a database, right? So you decluttered it, you restructured it, you cleaned it, you cleared it, and you keep it that way by maintaining it, like I do. Like I write like once a week, or when I feel something coming on, then I write more. If there's a lot of stuff going on at work, for example, or at home, you need to write more, right? But once you
read on the page and meditate your way to a calmer life.
Excuse me?
Rage on the page and meditate your way to the calmer life.
Yes.
Yeah.
Yeah.
Yeah, right. So this is what we can do to, heal our pain, or, relieve ourselves. But most of the times, we doctors, we are not really open in our mind to understand this approach, right? Whenever a patient walks into our clinic, we look at any structural pain, anything that we can see clinically, and then we go in for the treatment. Like, for example, I had a patient. I'm a gum surgeon, and I had a patient who had an epithelial, she had an autoimmune disease in her gums. Okay, and we used to prescribe her a steroid gum paint, which would stop the inflammatory reaction, and she won't have any problem. But when I was consulting her, I asked her if she had any more, excessive stress factors in her life, and to which she responded that she had, her son had a syndrome, and because of which he was bedridden and she had to take care of him. So these things need to be addressed. And because I am a dentist, I couldn't actually, dive in and tell her to go to a therapist, or, try to, take this approach to her, for her treatment. But yeah, I did suggest her to, try to work on her stress levels. So doctors need to be open towards this mind-body approach too.
Yeah, and I think actually a lot of doctors are frustrated, because there's up to 90% of doctor visits are because of stress-related conditions. And there is very little that doctors can do to permanently address those issues. And I had a discussion with my doctor a couple of years ago on this, and he says, I'm frustrated, and I understand, right? Because they're not given the tools to address this. And often, as you did with your patient, often it can already help if a person of authority, a doctor, listens to the patient. Just listening what else is going on. And because that's not happening, because people need to be heard, they need to be understood, and they need to be able to express themselves about pain and whatever else is going on. And when you do that to an authority figure, it's more healing than to a friend, actually. But unfortunately, like in the US, I lived in the US for 20 years. In the US, you have 10 minutes with a doctor, right? 10 minutes. And that's just not enough, for anything, because we're complicated beings. We're a mind, body, and a soul. And we're becoming more and more isolated with medicine, where we just look at the knee, and more specialized, right? And I just feel like this is going completely wrong direction. We need holistic healing. And I know in India, there's a lot of Ayurveda, which is taking it into the right direction. Actually, I spent a lot of time in India. I did 7 panchakarmas. But even there, I have to say, the one thing that's missing again is the emotional purge. Because what I've seen in a lot of the panchakarmas I did in Kerala, people got really depressed, and so much, emotional garbage was coming out, and they had no way of releasing that. And then I saw one Ayurvedic clinic. They started to employ a psychologist, which is taking it in the right direction. But yeah, that's where we need to go. So even Ayurveda, needs a tool for the emotions. Yeah.
Mhm.
Yeah.
Help us out of the pain. So then mind body syndrome is what you talked about today, and you put so much light on how we can address the pain which most of us suffer on everyday basis. And it is literally become a normal thing in these days that I have a back pain, I have a neck pain. It's normal. But you need to address that, and you need to deal with it. And there are many different approaches to it. So, what is your message, Susanne, to everybody listening to us today? What would you like to tell them? And how would you like them to take this approach?
So, I mean, if you guys out there have chronic pain, and again, chronic pain and symptoms, it's not just pain, it's also symptoms like gastrointestinal symptoms and whatnot. I mean, take a look at this approach, because why go on suffering for decades when you can actually start taking a step in this direction and potentially heal? And, I'm not saying that all pain is the mind-body syndrome, but like I said, up to 80%, unfortunately, or let's say fortunately, is. Even if your pain is structural, if you employ this approach, part of your pain will anyhow be the mind-body syndrome. Even if you have your purely structural pain, a part of it will be the mind-body syndrome. So you can benefit from this as well. And I hear a lot of people, yeah, that's cute what you're talking about, but my pain is structural because I am the exception and I am different. Trust me, I was there as well. I was convinced, yeah, that's cute. I mean, it's, yeah, sweet. Maybe it works for other people. But for me, because I had the MRI proving that my disc was pressing on the nerve. And to me, it was like, that's a structural issue. It's not. Because if you take MRIs or X-rays of, the whole city of Delhi, you will find that people under 40 up to, I think, 30% have bulging discs, but they have no pain. I mean, people without pain, I'm talking about. And I think people over 50, it's like 60% have bulging discs or desiccated discs or whatnot, but they're pain free. So just having a bulging disc does not mean that you have a structural problem, because there's a lot of people walking around with bulging discs without pain, and there's a lot of people walking around with perfect backs with pain. So that's also studies you can Google. You can validate everything I said. It's out there. So it's, if you don't want to be bent over in pain, I would give this a go, because it's not so difficult. A lot of people have done it.
It's always talking to you. It doesn't always talk to you in English. Sometimes it talks to you in the language of pain, and you need to listen to it, right? So the mind-body approach it is. Thank you, Susanne, for your time and being here and sharing your light to us and letting us know about how the different approach to pain and maybe the diseases that we encounter on a daily basis, especially the doctors listening to this show today. Thank you so much.
Thank you very much for having me.